It's a nightmare after nightmare at hospitals all across the country. As coronavirus cases surge dangerously in India, hospitals are being totally overwhelmed in cities and towns all across India. Take a look at these images from different parts of the country. The first image that I want to show you, these harrowing scenes of dead bodies being piled upon one another outside the Bhim Rao Hospital in Raipur, the capital city of Chhattisgarh. These images have surfaced today. The hospital has completely run out of space to store corpses due to the recent COVID-19 surge across the state. Chhattisgarh is among the worst hit states in the country in this second wave. And these are images that we're seeing in different hospitals, not just this one. The second image that I want to bring to you is from Ahmedabad in Gujarat. Again, one of the worst hit places. The biggest civil hospital in Ahmedabad with 1,200 beds has no space for further intake of patients. If you live in Ahmedabad and are trying to get a bed, well, good luck to you. Any new patient arriving at this hospital and many others is being given primary treatment inside ambulances parked outside the hospital by medical staff because there's simply no place. Patients who require oxygen support are also being given oxygen support in ambulances. No beds. At 1,907, Ahmedabad city has reported the highest number of new cases in Gujarat in the last 24 hours. The next image that we're getting to you is from Satara in Maharashtra. A COVID patient was administered oxygen and saline drip in a rickshaw outside the Vaduz Rural Hospital because of shortage of beds in the hospital over there. Imagine sitting in an auto rickshaw and receiving essential medical care. The number of patients with the coronavirus have increased in Maharashtra, Satara district, and all COVID hospitals in the district are bursting at the seams. Presently, there are 8,426 active patients in just this district alone. Maharashtra is the worst hit state in the country. So let's take you from Satara now to Baramati. This is Sharad Pawar's constituency in Maharashtra. Patients are getting oxygen on the veranda of the Silver Jubilee Hospital in Baramati. The overcrowded hospital has completely run out of beds. With a capacity to treat just 92 patients, the hospital is forced to treat over 100 in excess. And that's why verandas, corridors are chock-a-block with COVID patients and those looking to get tested. It's an all-out disaster situation there in Baramati. Now let's take you to Nalasopara near Mumbai. Ruckus has broken out after 7 COVID-19 patients lost their lives in just 3 hours at the Nalasopara hospital in Mumbai. Relatives are alleging that the deaths were caused due to lack of oxygen supplies. The families of the deceased have gheraoed the hospital, alleging that the administration did not inform them about the shortage of oxygen cylinders. And scenes like these could erupt very soon in different hospitals as deaths increase and as resources completely run out. Let me list for you now what citizens are facing. And listen carefully, ladies and gentlemen, because this applies to everyone. I personally know many people who are facing all of these, and I'm going to get you those voices here on India Today. Number one, an acute shortage of beds. Hospitals are turning away patients because there are simply no beds to put them in. Number two, big delays in admission. That's why there are long lines outside and you're seeing people being treated in ambulances. Number three, doctors are stretched and overwhelmed, which is why you're seeing many of them coming under attack. The number of deaths is increasing on site in hospitals because doctors are unable to treat so many people in such a limited span of time. Number four, there is a scary shortage of remdesivir and other COVID-specific medicines. Those medicines are running out. There is a shortage. They're not available even though exports have been stopped. Availability of drugs has become a real issue. This is something that has affected people all across the country. There is a delay in getting tests. If you want to get a COVID test now, it's very difficult for you to get that test. just a few days ago, it was very simple. You called a number, someone would come to your house, or you could go to a test lab and get your test done, and you would get the test results the following day. Now, there is a waiting period of at least 5, 6, sometimes even 10 days to even get the test done. And then you have to wait at least 3 to 4 days to get a result on that test. So testing is another huge, huge nightmare area for citizens all across the country. Resources are shrinking for non-COVID patients. You may not be suffering from COVID, but you may have other ailments, you may have other diseases, you may be suffering from cancer, you may have an injury, you may need to get treated. But because of the shrinking resources in the country healthcare-wise, non-COVID facilities are being converted into COVID to cater for this huge expansion in numbers, and therefore non-COVID patients are facing the brunt as well. I want to quickly get a word in from the ground. India Today's Pankaj Upadhyay is live with me from Mumbai. Pankaj, lockdown imminent in Mumbai and the rest of Maharashtra. How bad is the situation? I understand that from hospital after hospital, area after area, Pankaj, forget about admission. It's difficult for people to even get a basic COVID test now.
Absolutely, Shiv. Situation on ground zero remains pretty grim. Here the important thing is we have the statement from Aslam Sheikh. He's the Guardian Minister of Mumbai City. What he has said today is important. He says, we had meetings and discussions with opposition, businessmen, COVID-19 task force and others in the last few days. And today evening, we will be bringing out extremely tough and strict SOPs and guidelines for Mumbai and Maharashtra. It will be tough, but important. This is an indicator that what the Maharashtra government is now planning. Additionally, Shiv, let me draw your attention to some of the figures. This will show how much pressure is the health infrastructure of the city really is. As far as the ICU bed capacity is concerned, the number is 2542, occupied 2482, available only 60. Ventilator bed capacity 1330, occupied 1320. That means available count only 20. You can well imagine how bad the situation really is on ground zero. I called up a war room just few moments back. They don't pick up. They're saying that the sheer volume of calls that they are getting by the minute has really overwhelmed them. Ambulances are not easily available. They are asking the patient to directly reach the COVID center. But the regulation does not even allow that. You can only reach a COVID hospital center only through a COVID war room.
Okay.
The municipal commissioner has said that the tests should be turned around within 24 hours. But then when you are conducting 40,000 to 50,000 tests a day, how will the labs turn out the tests within 24 hours? On ground zero,
very disturbing.
It looks like a complete chaos.
Very disturbing, and this could lead to civil unrest. That is the point. People are losing their patience as well because they are desperate for medical care, and when they're not getting it, they are losing their cool. There are fights taking place in different hospitals, and this is going to be a recipe for civil unrest. Pankaj, thank you very much for that. Amidst this sharp rise in COVID cases in the national capital, Mumbai is terribly grim. The national capital has just recorded over 11,000 cases for the first time in just a 24-hour period. Patients are struggling to find beds in hospitals. The Delhi government says there is no shortage of beds at present, but if hospitals are overburdened, the government may have to resort to another lockdown. Take a look at how bad things are in Delhi as well.
COVID-free run in Delhi. The frightening spike breaking all records. Hospital beds, ventilators running short. To meet the sudden rise of COVID rush at hospitals, the Delhi government reserved 14 private hospitals and 4 big government hospitals for only COVID patients. While bed capacity at 115 private hospitals were raised, non-COVID patients have few options left, as 60 to 80% beds in majority of hospitals are already kept for COVID alone.
एम्स वालों ने कह दिया बिना देखे कि बेड खाली नहीं है, पर्चे दिखाए. उसके बाद उन्होंने कहा सब दर्जन में ले जाइए. सब दर्जन में ला के दिखाया. पूरी रात उन्होंने कहीं एक्सरा करवाया, कहीं जांच करवाई ईसीजी. उसके बावजूद उन्होंने कह दिया बेड खाली नहीं है. लो हम लिख के दे रहे हैं, चाहे कहीं भी ले जाइए.
Some of Delhi's most well-known hospitals like Sir Gangaram Hospital, Holy Family Hospital, Max Saket and Fortis are now exclusively treating COVID patients only.
4 दिल्ली गवर्नमेंट की हॉस्पिटल को फुल्ली कोरोना डेडिकेट किया गया है और 2 दिल्ली सरकार के हॉस्पिटल्स को बहुत बड़ी संख्या में, जैसे एलएनजेपी में 1500 बेड और जीटीबी में 1000 बेड.
The Delhi government allays fears for looming bed crunch for non-COVID patients, saying the COVID quota at hospitals is a temporary move till situation improves.
अभी आज की डेट में 12,600 बेड कोरोना के, जिसमें 5,000 अवेलेबल हैं और हम समझ रहे हैं कि जो ये 3-4 दिन में सारे बेड अवेलेबल हो जाएंगे तो इससे हमारी बेड्स की समस्या अभी तक तो नहीं है, आगे भी मुझे लगता है ये मेंटेन रहेगा, ठीक रहेगा.
The Delhi government has meanwhile also set up a 24/7 COVID cell to monitor the rising death rate.
दिल्ली में अभी फिलहाल हेल्थ सिस्टम हमारा कंट्रोल में है, लेकिन अगर केसेस मान लीजिए कल को बहुत ज़्यादा बढ़ जाते हैं, बहुत तेज़ी से बढ़ जाते हैं और हमारे यहाँ बेड नहीं बचते, हमारे यहाँ ऑक्सीजन सिलेंडर नहीं बचते, आईसीयू नहीं बचते, तो हो सकता है फिर हमें इसको स्लो करने के लिए थोड़े दिन के लिए लॉकडाउन लगाना पड़े.
Crucially, Delhi Chief Minister Arvind Kejriwal has hinted at a full lockdown if healthcare system is overwhelmed. It's a sense of COVID deja vu in Delhi. Can the capital meet twin challenges of keeping COVID tally low and avert a lockdown? With Milan Sharma in Delhi, Bureau Report, India Today.
What? I'm joined by persons from all across the country today who have faced hospital nightmares personally. They've suffered personal losses and they're still fighting it. We've invited people from all across the country and these are the voices we wanted to bring to you because their accounts will resonate with you. This is something that's already happening with many of you and you probably might even experience it because of how bad things are. So there are lessons to be learned here. Joining me live, we have Tapan Zaveri, who is the relative of a COVID patient. We have Vishal Manganani, who is also the relative of a COVID patient. We have Dr. Harsh Mahajan, founder of the Mahajan Imaging. Dr. Parul M. Sharma, who is a well-known ophthalmologist. We have Dr. Prateet Samdani, who is an intensivist COVID expert. All of these are persons who are on the front line of the COVID fight and also people who are facing the brunt of this current surge in cases. Tapan, I want to come to you first. First of all, I'd like to extend my condolences. I'm told that you lost your father recently from COVID and that you've also faced a really bad experience as far as healthcare services in Mumbai is concerned. Take us through how bad it was. Once again, I'm very sorry to hear for your loss. Tapan, go ahead.
Yeah, sorry. So actually, my father was admitted in a non-COVID hospital due to some illness. So he had suffered some paralysis and brain stroke and other, medical conditions. But due to these, COVID conditions, the hospital started taking in COVID patients, due to which my father got, infected with COVID in a non-COVID hospital. And by the time we could realize there are COVID positive patients in the hospital, we tried to transfer him to a non-COVID hospital, but ultimately he did get affected. Now, we tried to, help him, or we tried to work as much as we can, but ultimately he was positive. And, when we shifted him to another hospital, the second hospital asked us to get him shifted to a full-time COVID hospital as early as possible. So they were like, it's a non-COVID hospital and we will not be able to accommodate him we will just keep him until, till the time you can at least arrange for a bed in some hospital.
Yes.
So we tried calling the war room. We tried our luck. We struggled a lot, but there were no beds available at all. So I particularly live in Mumbai. I tried calling war rooms from other locations. And I was clearly being told that first we will try to accommodate the patients from our war room and from our locality. And if there is anything available, then we will reach out to you. So we had a really hard time trying to, find a bed for him. He was already in ICU. He was struggling with his last breath. But, there was no ray of hope. So I had to try, I had to make a few phone calls. I tried to, get something done for him. So I finally found a private hospital where we could, actually get him admitted. But I'm really not sure what exactly is happening and why are they, it's just a ripoff, because at the private hospital where we got him admitted, it was not even 1.5 days, and the bill amount, the bill that they gave me was close to around 60,000 in just 1.5 days. And I'm really not sure what kind of treatment was given to him, because my father was not in his conscious state. So we could not even talk to him, or we could not even understand what's really happening. And
Yes.
Looking at the situation, we had to actually, figure out a way and get him transferred to another hospital, because I really could not, being a middle class person, I could not afford 55 to 60,000 worth of bill in just one day. So, so last night, unfortunately, he fought a lot, but he passed away. And during this entire tenure of about around 10 days, we got him tested for another RT-PCR, trying to figure out if he's actually got if he's actually got negative or not. Now, today it's been, I think, 7 days since the sample was collected for his RT-PCR test. I've lost my father, but I still don't know if he's still positive or if he was negative. It's been 7 days. We don't know what the report was. And last night we got a call at around 11:30 p.m. from the hospital that my father has passed away. We reached at the hospital. We completed all the formalities by around, I would say, maybe 12:30 in the night. And we were
Tapan, I am truly, truly so sorry to hear about your loss. We've just lost a bit of that link there. I'm going to let Tapan finish that story, but this is truly, truly heartbreaking when he says he's still waiting for the test results. Tapan, you want to finish what you were saying? Yes.
Yeah, sorry for that. So I completed all the formalities. I completed the procedure for, the death certificate and everything. All the paperwork was done by 12:30. And we were struggling for almost 4 hours just for an ambulance to, take him to for his final rites. But so BMC just kept on saying, yes, the ambulance should be there in 10 minutes, 15 minutes. Finally, I got the phone number for the driver of the ambulance. And when I called him, the driver just gave me an excuse that I have quit the BMC job. And now I'm running on my my private ambulance. And if you want me to get this done for you, you have to pay me 7,000 rupees for just taking him from the hospital.
Listening to your story, Tapan, it occurs to me, and this is reflective of people's experiences everywhere, that humanity is also going away because, as this problem increases, as hospitals are getting overwhelmed, as there are more and more patients coming up, not only are hospitals unable to manage, but the humanity of the healthcare system is also inevitably being washed away as a result of the magnitude of the problem. Vishal Mangnani is a relative of COVID patients as well. Both of your parents are currently COVID positive, Vishal, if I'm not mistaken, and you've been facing these problems every day as well. You've been, dialing the phone, trying to run around, organize medicines. How bad has your experience been?
Shiv, first, my heart goes out to everybody who's suffering from this virus.
Yes.
It is an absolutely delicate situation. And my advice to everybody who's in the support system, the family members, please be strong. Pray a lot, be positive, ask for help. Mumbaikars have a fabulous spirit. They will come through for you. They have come through for me and my family. They will come through for you. But let's face it, let's be absolutely honest here, Shiv. The medical facilities, the entire healthcare facilities in the state of Maharashtra and Mumbai have collapsed. They have absolutely gone to ground zero. From taking tests to getting beds in hospitals to getting life-saving drugs to actually scoring ambulances to pick up your parents and drop them across. The whole system has collapsed. And my only one question to the people in charge over here is, we knew there was a second wave coming. Globally, we knew there was a second wave coming. 107 years ago, we knew there was a second wave. Why did we not act? Why did we not act accordingly? Why did we shut down COVID centers? Why did we stop or reduce the production of life-saving drugs or whatever drugs are prescribed and available right now? Because, it's sad to see people standing outside the ICU and crying. My father's in the ICU. He's struggling. We've been really blessed to get a fantastic legal team who's really been struggling with him on a day-to-day basis. My mother's living alone in the house because she's COVID positive as well, luckily asymptomatic. And I am staying outside the house because I'm the only support person here.
Yeah, yeah.
I mean, how is the state going to look after my elderly parents if I get COVID positive and I land up in a hospital or I'll end up being quarantined as well? There's no fail-safe. And we come from a city where the medical care is the best in the country.
Exactly.
I'm so proud to be a Mumbaikar. I'm so proud to be a Mumbaikar. But right now, where are the doctors being panelized or being put in a task force? I spoke to Dr. Samdani myself. I randomly got a friend's number and called him up. And I took advice and he said, you know what, blah, blah, blah. You're going the right way, hospitalization, blah, blah, blah. And the next question was, thank you so much, sir, but where do I go? And he said, you must talk to your GP about it.
Yeah.
My general physician has no clue. My general physician is clueless. He goes, try on your own. So if my general physician gives up, if BMC is overburdened, the hospitals are overburdened, the pharmacies have said no, the druggists
what you're
have said
saying,
no.
Vishal, really resonates because Mumbai is reputed to have really robust and good healthcare. And if Mumbai is unable to, keep up, what is to say of other cities? Dr. Pratit Samdani, who's an intensivist COVID expert, is with me. Dr. Samdani, would you like to explain to us how badly are doctors affected in all of this? Doctors themselves are also hugely stretched. As you heard Vishal say, when he calls his doctor, they're unable to guide them on what to do because of the scale of this crisis, sir.
Yes, completely agree, Shiv, and condolences to Mr. Zaveri. And what Vishal is saying is completely true. There is a complete scarcity in this city of hospital beds, ICUs, and thus ventilators. And I do fear, and I hope this is not true, that there will be a shortage of oxygenation no sooner than later. So what's happening to the healthcare system? See, the doctors are limited in every city, every place, every town, every country. The way this virus is spreading, it's an impossible task for the medical staff and the team and the healthcare workers to cater to every patient. What we've been doing is we've been working almost virtually 24 hours a day. I haven't met my family. I haven't had a meal with them for the last 20 days. And that is true. All of us are right there. See what happens? We enter a COVID ward and our mobiles are not with us. The moment we are doffing or taking out a PPE, you actually realize that you've got so many missed calls that you don't know who's called you because the list is completely erased. You've got 150 messages in a span of 3 hours in a hospital, and I completely sympathize with the patients. My advice to the Mumbaikar and to every citizen in this country is please call the helpline. Please keep calling the nearest hospital. If you get a bed, if they require admission, go. Advice to them is also to seek medical help early. Don't wait for yourself or kith and kin or father and mother to actually deteriorate because time is so precious and this critical situation where there are no beds available, it's going to be extremely difficult and we don't want anyone to lose their lives because of lack of availability of healthcare. And it's needless to say, this virus is there. It has a morbidity and it has a mortality. But the best that we can support our patients and the healthcare team is going all out to do them, and we are all with you at every moment.
And doctors themselves are overwhelmed. You know, it's not just the patients. Imagine the plight of doctors who themselves are faced with this enormous new workload, which they simply can't manage because after all, there are only a limited number of doctors, a limited number of ambulance drivers, etc., etc. So the entire system has really crumbled. Dr. Harsh Mahajan, founder of Mahajan Imaging, is also with us. Dr. Mahajan, one of the other nightmare complaints that we're getting from people all across Mumbai, Delhi, elsewhere is, the ease with which one could get tested for COVID until a few days ago is no longer the case. People are saying, 10 din ke baad milega aapko date and, 11 din ke baad. People are having to wait a large number of days even to get a basic COVID test now, sir.
Yes, at the outset, my condolences. A life lost is always tragic. As regards testing, from barely 100 tests that we were able to do in end of March, April last year, India ramped it up to about 1.6 million tests a day. So a lot of thought, a lot of planning, a lot of investment, a lot of manpower went into achieving this target. And this happened gradually. What happened in the last 3 months is that once the numbers came down, everyone went about business as normal. And as Vishal said, we always knew that a second wave is going to come. It's inevitable. It is history shows that it is going to happen. But somehow, all of us as citizens, governments, we all lost sight of this. And what has happened now is that the surge has been nearly vertical. It's like, not like an aeroplane taking off, but like a jet taking off. And capacity, even though huge, is still limited because the numbers have increased exponentially. And we were very proud of the fact that in India, we were able to give most reports within 24 hours, even when there were 1.6 million tests done a day. And in the US, it used to be 7-8 days.
Okay.
Now with this surge, we are also facing the same problem. There are capacity constraints. There is only that much that you can do more. You can have 2 shifts, you can have 3 shifts. But in the acute situation, you can't import machines so quickly.
I hear what you're saying. I hear what you're saying, Dr. Mahajan. You're saying that there is a limit to how much you can scale things up based on the resources you currently have. In fact, one of the other concerns is non-COVID patients, people who don't have COVID, but who need access to resources. Those resources are also becoming very, very low. Dr. Parul Sharma is a very well-known ophthalmologist based in Gurgaon. She's with us live. Dr. Sharma, you put out a tweet earlier today where you said that doctors should protest. Maybe it was an emotional response, but I agree with it. It actually spoke about some of the problems that people are facing. That there are all these melas that are happening, these election rallies. At the same time, you've got this healthcare system that's absolutely crumbling at this point of time, and the healthcare system is simply unable to cope with that. Dr. Sharma, how bad is this situation for non-COVID patients? Okay, we don't have Dr. Parul Sharma for a moment. We'll just get back to her in a moment. But Tapan, coming back to you, we consider people, we consider ourselves people who can maybe sometimes pick up a phone, take a favor, try and pull some strings to arrange some kind of help. But it seems like even that is not working anymore because the system is crumbled. It's each man for himself, and it's difficult to even pull strings and get things working for you now.
Yes. So, and just to add to all of that, I've been facing since yesterday. Finally, when I actually got hold of an ambulance to take my father for his last rites. When we finally reached at the location, the driver was asking me for 500 rupees as a tip, or he just said, "Mujhe please bakshish de do," just because I arranged an ambulance for you, and I just brought him from the ambulance to the place where we are going to do the last rites. I mean, I'm seriously shocked. Where is humanity? And me losing my father, terrible. And that person is asking me for a tip. I'm really not sure what's happening.
It's that is really scary. I mean, that is scary and morbid and really sad and kind of tragic at one level. I mean, I can't even imagine what that's like when people can demand money like that when you've just faced a tragedy. Dr. Sharma, I hope you can hear me, ma'am. Non-COVID patients are also very nervous. They're wondering how will they be able to get themselves treated with this growing COVID crisis.
Yeah, so I've been hearing all the people here, and my first thing is condolences to the.
Okay, I'm sorry about that link. It's very, very poor with Dr. Sharma. We'll try and patch her a little better on that. But Dr. Samdani, if I could come to you on how are doctors coping with this wave of patients? Many are, having to treat hundreds upon hundreds of patients, in a single day. What kind of toll is this taking on doctors?
It's the similar toll that it's taking on patients and their relatives. So there's an emotional debacle. You have anxiety. You have fear. You also have fear when you're going to a war zone and you're going to war every morning and every day and every night. You're fearful of your life. You're fearful of your family losing you. So it's got an emotional thrust. You are depressed. You're fearful. You're anxious. There's agony. There's also agony because of the healthcare system just crumbling completely. And it's taking a complete mental and physical toll. Imagine working in that PPE suit. By the time you're out of the suit, I can assure you and take it from all of us, we are drenching as if we've had a hot water shower. It is so stressful. It's a terrible state. And I completely salute all the sisters, the ward boys and technicians who are working so hard. They're doing double shifts. They're away from their families for the last 1 year. And it's commendable the way the healthcare system is going ahead. But it's not an easy situation there. We also urge all our patients to understand that it's so difficult for us, yet we have to keep our patients down and answer the same question, and most importantly, treat them as aggressively to get them out of this crisis.
Dr. Samdhani, and to all of my other guests, thank you very much for being with me. This is a difficult time for you all, much more than me. I'm not going to say us, especially all of you on the front line, not just of the crisis, but those of you like Tapan facing tragedy. Vishal, who has parents who are COVID positive and is dealing with a crumbling crisis. I cannot imagine your pain, and I cannot imagine the kind of difficulties that you're facing. My prayers and India Today's prayers are with all of you. I promise that hospital horrors and this nightmare is a story that I will continue to cover each and every single day. I'm not feeding off your stories. I want to amplify them because these are stories that need to be told. The system needs to be brought back on track, and I promise you I will stay with this story. Thank you to all of you for giving me your time.
Hello everyone, this is Rahul Kamal here. Hope you enjoyed this video. For the latest news and analysis, like and subscribe the India Today YouTube channel, and don't forget to press the bell icon to stay updated.